I'm one of the first year preventive medicine resident, but I did 3 years of general surgery residency at Mount Sinai Hospital. I'm going to be talking about optimizing emergency room visits and just making sure that you know when to go to the emergency room so that it's not too late for any optimal interventions. Just some information about long COVID, who's at most risk are those who didn't receive a COVID vaccine and who have experienced more severe COVID illness, especially those who were hospitalized and then those who had prior underlying health conditions. And then some common symptoms are coughing or breathing problems, loss of smell or change in taste, body aches, headaches, chest pain, and the list goes on and on. There's actually no test for this condition called long COVID when you have like acute COVID and you have like acute symptoms. But if you think you have long COVID and these common symptoms and you're concerned, talk to your healthcare provider or scan this QR code right here in the right lower corner. There's also this link that you can also visit. And then just a reminder for vaccines, please stay up to date. This is for both you and for the community to keep everyone safe. COVID, the new 2024 booster is available. It's available for everyone above the age of 6 months. And if you're unvaccinated, the recommended doses are 2 doses of Moderna or 3 doses of Pfizer. The flu shot is also available. I know people are having pretty severe flu at this time around. Even if you do get the flu after the vaccine, it really saves you like a hospital stay. And then RSV, the recommendation is that you should get 1 shot if you're age greater than 60. And then pneumonia, if you're high risk, meaning if you're age above 65, if you're pregnant, if you have HIV, cancer, diabetes, or heart disease, you should get 1 dose, especially for those who are between the ages of 19 and 64. And then for all adults above 65, you should get 1 dose. As a general surgery resident, we go down to see patients who the emergency doctors say are very critically ill. And that is my least favorite place. It's disorienting. Patients are there for an unreasonable amount of time. While I want to have you get the optimal medical care when needed, I also want to save you a trip by giving you some of these pointers. Some background. It's estimated that the US loses apparently 136.6 billion annually due to emergency room visits. And this is a significant financial strain for the US, and it represents about 12% of the national health expenditures, which is a pretty hefty amount. The average ER visit lasts around 154 to 250 minutes, which is up to 4 hours. And that's across the country. I think in New York, because we're just so heavily populated and there's only some amount of space that we can place patients into rooms and beds, I think this is even bigger. I've seen patients stay like 24 hours in the ED before, which is horrible. So how can we reduce losses incurred from ER visits, both financially and just time-wise? I think one is to establish really good primary care doctor visits. And then number 2, which what I'm trying to do is to enhance education. So these are a variety of symptoms that you should be on the lookout for, and I'm going to group them in terms of body systems. The first one that I want to go into is neurological emergencies. I'm sure you have heard of the fast pneumonic. This is conditions and symptoms that might be concerning for stroke. So F stands for face, if there's one side face drooping, and then A stands for arm, if you have like arm weaknesses, and then S is for speech, if you see a patient with speech like slurring or if they're having difficulty finding words, and then T just means act right away, call the ambulance, call the most fast way for you to be able to go to the hospital to get further evaluation. And some other symptoms that you should be on the lookout for if you have very severe headaches. Some patients describe it as the worst headache of my life, and that's maybe an indication that you have like a bleed in the cranium. And then if you have focal weakness, which is related to the A in the fast pneumonic. So if you have like a weakness in one area of the body more than others, that also is a symptom that you should be on the lookout for because it could also indicate like bleeding or stroke. And then seizures, if you have seizures, right away should go to the emergency room, regardless of what reason. And then moving on to cardiovascular emergencies, heart attacks are very dangerous. So heart attack falls into this very wide umbrella of something called an acute coronary syndrome. That warrants evaluation by a doctor right away. Some symptoms that you should be on the lookout for are chest pain, severe dyspnea, which is shortness of breath or inability to breathe. If you have syncope, meaning you have like loss loss of consciousness or you're very close to blacking out. And then palpitation, meaning you feel your heart like beating very quickly, or you just feel your heart beating like very loudly. And then hypertensive emergencies are when you have dangerously elevated blood pressure. Elevated blood pressure has been known to be the leading silent killer in the world, actually, not just the United States. And blood pressures above 180 over 120 is considered dangerous with potential to cause any sort of organ damage, specifically the brain, the eyes, the kidneys, and these are all important organs that you need to survive. But if your blood pressure is elevated, meaning if it's above 130 over 80 and you are still experiencing any of the following symptoms where you have a headache, chest pain, shortness of breath, blurry vision, nausea and vomiting, confusion, numbness, dizziness, these are all reasons to go to the emergency room and check it out. These are not things that you should be like sitting on, especially because if you get intervention within a certain period of time, then it might save you a more invasive procedure like a big heart surgery. So these are all things that you should be on the lookout for. And then my favorite, which has to do with general surgery and things, which I'm a general surgeon. So abdominal emergencies, the two most common abdominal diagnoses that I see from the emergency room are either appendicitis or cholecystitis. So appendicitis is when you have an inflammation of the appendix, which is located right here at one of the ends of your colon. And if you have abdominal pain, that's often very like generalized. So it's like everywhere in your belly, and then it goes to the right lower aspect of your belly, then be very suspicious of appendicitis. A lot of the times it may not follow this pattern, but just keep in mind this is the most typical pattern. And so if it continues to worsen and it never improves, if you have intermittent pain where it gets better and then gets worse and then gets better, that probably isn't appendicitis. And then oftentimes if you have this abdominal pain with fevers, nausea, vomiting, and diarrhea, or if you have no bowel function at all, meaning you have no gas or no poop, then that is also a high indication that you may have appendicitis and should be checked out because it most often warrants a surgical removal of the appendix. And then if you have symptoms of cholecystitis, meaning you have an inflammation of the gallbladder, the gallbladder is attached to the liver, which is up in the right upper corner of your belly. So you should be suspicious of this, especially if you know that you have a history of gallbladder stones. And often there's pain in the right upper area, which is where I said the gallbladder is, and that's where it lives. It's associated with eating fatty foods, which if you have a history of gallbladder stones, you may have heard from your doctor. You may also experience symptoms like nausea, vomiting, fevers. And if you also have yellowing of your skin, which we call jaundice, and then low blood pressure with confusion, that is an absolute emergency and you have to go to the emergency room right away. This is one of my favorite memes. It's called The Gallbladder's Last Day. The gallbladder is showing the liver that they made stones and the liver's upset and says, "Oh, you're just supposed to hold what I give you, get out, go on." And then the gallbladder is really sad because then we have to remove it surgically. Some other abdominal emergencies that you should also be aware of. So abdominal pain that only appears to worsen and does not improve for like up to 3 to 4 hours. Plus, if you have the following symptoms, if you don't have any gas or stool, this is very concerning and you may have something called a small bowel obstruction, and that is something that really needs to go to the emergency room. If you have nausea and vomiting, that also doesn't seem to be getting any better and just continued throughout this period of time, along with fevers. These are all very concerning things and should be checked out by a doctor. Don't brave it out. Any other emergencies that warrant emergency room visits are severe soft tissue infections. If you guys look at this picture, the right upper corner, you see that this left leg is normal and the right one is very large, is swelling, and it's red, and they marked it here. The reason why they mark it with the marker is to make sure that it doesn't go up in the limb. So this is a sign of cellulitis. And the reason why we need to keep an eye out on cellulitis and it needs to be treated early is because it can turn into something called necrotizing soft tissue infection, meaning it can kill all the tissues underneath the bacteria that it's infected with. In really severe cases, this might even need an amputation. So waiting until the last minute is definitely not good. If you have this redness and you don't have sensation in your limbs or anywhere in your body, go to the emergency room right away. And if you have an abscess and it's like draining, that also needs to be checked out, although it's not like a big emergency, but you should also be treated with antibiotics. And if you have a heat stroke, this is a really big issue. It has been with climate change recently, and a lot of areas in the US are experiencing high temperatures. So if you've been exposed to the sun for way too long, you can have like headache, confusion, nausea, dizziness, high body temperatures, especially going above 103 Fahrenheit. Fahrenheit. You can have redness of the skin, dry or damp skin, and then you will almost always have rapid heart rate. It'll be like racing and very strong pulses because you've probably lost a lot of fluids from your body, and then you can also have fainting, loss of consciousness. It's really appropriate to assess frostbite and hypothermia because it's super cold and we're going to be getting more snow. So frostbite, if you look at this picture on the right bottom, you see that there's this superficial frostbite, which is not as concerning, but we want to prevent it from becoming a deep frostbite. So superficial frostbite is just any coloration with like whiteness, can also like cause some blisters. But if you rewarm within a certain time period, you're not at a big risk of losing a limb that's been exposed to frostbite. But if you wait until it becomes like this, where it's like dark and blue, that might be an indication that your hand is dead. This could also lead to amputation, so do not wait to go to the emergency room for this. And if you're experiencing numbness and severe swelling, that's a very concerning sign. So again, do not wait. And then hypothermia is also a very dangerous condition that can lead to death. So for someone who's been exposed to the cold for a long period of time without really much of a thick jacket and the appropriate clothing, they can also experience confusion or slurred speech, and they need to have their core body temperature be warmed up very quickly, which can be done in the emergency room. They probably need hospitalization afterwards. So these are all reasons that you should go to the emergency room for. I've told you the indications of going to the emergency room, but how do we minimize that and really optimize it for when we need it? It's really important to get plugged in with a primary care doctor. If you establish regular visits and you go see them frequently when indicated, they will know you and they know your body. So you can often have a conversation with them if they don't have room for you to come to an in-person visit, or they have someone on their staff who can advise you to see if you really need an ER visit. They have hotlines available even at night. A lot of the times patients don't realize that their primary care doctors have these hotlines where they have people on call and available to answer important questions to see if it's like a life-threatening condition that needs an ER visit. And they are in communication with your doctor even if they're not on call for that night. Really important to get plugged in with the primary care doctor. And your primary care doctor can really address preventive care, meaning they can provide vaccines. We talked about flu and possibilities of having to go to the emergency room or being hospitalized if the symptoms are really severe. A lot of the times the symptoms that we get can be from like cancers. So if you have really severe bleeding from the bottom, meaning like the anus, or if you have like blood in your vomit, that can be an indication that you may have cancer. But these things, they can be caught very early on before they progress to symptoms if you have a primary care doctor who can give you advice on when you can get a colonoscopy or a camera from the mouth. So just routine checkups are very important. When I was in college, I went to the emergency room for like intractable vomiting, and they gave me IV fluids and some medication, and I got bombed with the $3,000 bill. So a lot of the times insurance may not cover your visit, even if you have insurance, because they may say like, oh, the emergency room is for like life-threatening visits. Your condition is not life-threatening, so therefore you must pay a lot of money. These are things that are all reasons to get plugged in with the primary care doctor and work on preventive care. I am highly for visiting primary care doctors.
Are kidney stones considered an emergency?
Definitely, because they can turn into like infection and they can cause bloodstream infections. They can get you plugged in right away with a urinary doctor and they can perform procedures to help you.
What are the symptoms of that you should look out for that you would have a sense that it was kidney stones?
If you have like blood in your urine and you
Mhm.
have severe pain in one side of the back, usually it's not bilateral, meaning it's not both sides. It's usually just on one side. And then if it's infected, often like fevers, that's really important
Okay.
to keep an eye out for. But if you've had stones in the past and you're having like pain in that same area, then definitely a reason to go in.